Ebola is in Nigeria. Those words had me freaking out back in 2014, and that is what today's episode is all about. My name is Evelyn Castle, and thanks for joining the EHA Founders Podcast, where myself and my co-founder, Adam Thompson, discuss our journey founding our companies, the challenges we faced, and our lessons learned along the way. This conversation about the Ebola response in Nigeria is my favorite conversation Adam and I have had so far, and I'm really excited to share it with you. So I won't even bother with a long intro. Let's just get right into it. Welcome to our 5th episode. Today we're going to be talking about the Ebola response in Nigeria and yes, what we did in the Ebola response, but I think a lot about kind of how we felt about it in Nigeria and what our opinion was about the response in general, because obviously Nigeria gets credit for having a really successful Ebola response, and how that impacted COVID and all of these other things and polio and whatnot. And so I think it'll just be kind of an interesting conversation, especially now that we're sitting here a year into COVID, and did the Ebola response really have that big of an impact on how well we were able to do COVID?
Yeah.
So let's start a little bit just with the beginning of Ebola. So we're sitting in Nigeria and in Kano. The first time I really remember thinking about Guinea and Ebola was when I remember seeing the news story that came out that said that there was a big concert in Guinea. It was in Conakry, and multiple people got Ebola in that concert hall. And I remember thinking to myself, what the hell is happening? That an Ebola patient is at a concert, a big concert in Conakry. And there was a couple hundred suspected cases or something after that. So that's the first time I really remember even thinking about it. Do you have a specific memory?
I don't think so. I mean, I just think I remember the news, the various different news stories, and we were kind of watching it spread, into Sierra Leone and obviously into then Liberia. And we were worried that it was kind of, if things weren't really under control, it was a matter of time. I do remember, I think my feeling at the time I was a bit calm, because I remember seeing things US CDC and those things. And remember, those were the times where my vision of CDC was from the movies, from Outbreak and these things where it's these super teams. I remember being quite calm about it, even as it was spreading, thinking okay, well, this is what they do. They'll get this under control. And obviously that vision of, the global pandemic response has changed kind of dramatically so since then.
But at the time you felt super secure.
Yeah, and calm, and they got this.
Well, because it's actually funny. So I went back into my email and I just typed in search for Ebola, and I just went as far back in my email chain as I could find to find the first mention of ever us mentioning Ebola. And so it's funny because I'm sure we were starting to have some of these conversations, but the first email that I found about it is in August, which actually was right before it came, well, I guess right when it came to Nigeria, because it came to Nigeria in July and we still weren't even really talking about it that much until August. But in August, we really started planning for what happens if the outbreak continues. It's funny because the other really vivid memory I have is I remember starting to panic and starting to say I think that we should write an email to the Gates Foundation about what we're going to do if Ebola, spreads, and what will stay open and what will not stay open. I remember you being calm down, let's take a breath, let's wait and see what happens. But we did actually start planning. I have the email where we started talking about the EOCs will remain on duty, and then I think we had said GIS tracking would be suspended if cases are found in that state, basically. But again, it's funny because looking back on it now, if Ebola had really spread, I think it would have been probably all over the country pretty quickly.
Yeah, given how much people move.
Yeah. So anyways, we started kind of worrying about it much more in August. So I guess it must have been the first week of August. But so when it came to Lagos.
But it's crazy thinking about it because, all the stuff that we've learned, at no point did they stop flights. It's crazy. At no point did they stop flights into Nigeria even from the affected countries. That blows my mind.
That they should have?
Yeah, of course. Outbreak of Ebola in Liberia, I think if it was today, they'd stop flights. They'd stop allowing people from Liberia to come into Nigeria. You would just pause and be okay, let's see how to get this under control. You wouldn't just be well, let's see.
Yeah, I mean, I guess it's just like because I think they just made the assumption that everybody that had Ebola was so crazy sick
Yeah.
that they wouldn't be getting on
But there's
planes.
also this weird idea that like somehow you could screen for them at the airport by taking people's temperature. But as we've learned with COVID, no one knows how to even use those temperature things, and they don't actually even work most of the time. And so that was a stupid assumption that you could look at someone and be like, that person's sick with Ebola, can't come in. Because then what do? You have them wait in the airport, infect more people, and then send them home? Like what people assumed was possible in the airports, I think even during Ebola, obviously we've learned during COVID
Mm-hmm.
that was silly to even think that that was an option. And, a lot more thought has to go into around how do you manage travel.
Yeah.
That didn't go into it during Ebola so much.
Mm-hmm.
Like there was certain types of ideas and plans that you would restrict travel but like they just kept checking for yellow cards. And that always blew my mind. It's like, it's Ebola. What does my yellow fever vaccination have to do with anything?
Mm-hmm.
But they would just before Ebola, they would never check. After Ebola was gone, they wouldn't care about your yellow cards. But during the Ebola outbreak, we have to check your yellow fever vaccination.
Mm-hmm.
And like, I was like, that doesn't stop anyway. But yeah, all these things and systems that didn't make sense. Even though we knew the dysfunction in Nigeria, we kind of I assumed that those were relatively in place.
Yeah. I mean, I guess not right away did they limit flights, but eventually they did. They ended flights from the Ebola endemic countries. Because remember, like only Air Morocco was flying in at a certain time. Like BA pulled out of Sierra Leone, Air France stopped flying. Yeah, at a certain point that did happen.
But that was the airlines deciding they're not going to go.
That's correct, yeah. Mm-hmm. Okay, so do you remember when it came to Lagos? Do you remember like what your initial thought was?
I mean, I remember thinking that this is the kind of thing that would tear through Lagos. I just remember thinking like the close proximity of everybody, the fact that Lagos is just people on top of people on top of people. Yeah, I really thought that was the end.
Well, I think we all kind of did, and that's why like we went into such hyper alert at that point, and why I guess when we were asked to go down to help, we immediately said yes, even without, that much financial control and all of that. But I was trying to remember, do you remember who called us? Was it Faisal? Do you remember the phone call where he called us?
Yeah, I remember I was sitting in the ECNX office, our office, in the second floor or first floor. I don't remember the details, but I remember sitting there having the phone call saying like, let me get back to you. Then you and I chatting. Faisal called this and then talking with him a bit later in the day. And then, yeah, it's starting to make plans right from there about like, okay, let's get down there.
So we decided that we were going to do it. I stayed in Kano because obviously we had a ton of fish that we were doing in Kano. And you went down with just yourself, right, at first?
Just me at first, yeah.
Yeah. And do you remember like what it was like being down there? Because like I didn't go to Lagos, I think, until months. Maybe it was like a month or so later. And I remember the kind of like hysteria. Like it's really hard not to compare now like Ebola to COVID, right? Because it was like people were so much more freaked out about Ebola, but like there was no such thing as like lockdowns. People were not like reducing their travel or anything like that. I remember it was just like,
but they did voluntarily. I mean, yeah, there were like some hand washing stations and there's a huge run on hand sanitizers and soaps and things like that. But like when I first got to Lagos, like people were staying away from other people. People weren't wearing masks. Some people were, not like with COVID. Like people are wearing masks, people were wearing gloves, but not everybody. But like I remember like going by one of the bus lines and seeing people like you just see this group of people, like 10 people all trying to get in the door at the same time. And I remember going by and seeing like a line of people like spaced out where everyone was, and again, not mandated, no one told them to do it. There's very little coming out at the time around things like social distancing and hygiene and stuff like that. They were starting to kind of get the messaging out, like, be careful, do these things. But yeah, people were so scared, they just kind of did it voluntarily, which is like so funny now compared to COVID, where it just felt like such a slog to convince people to wear a mask and wash their hands. Whereas during Ebola, everyone was like, stay the hell away from me. Don't touch me.
Which again, totally understandable.
Yeah.
If COVID had you bleeding out of your eyes,
yeah,
you would have the exact same response to that. And then the other big thing that I remember like during that time was all the local cures that were coming out that more people were dying of. But again, just the
salt overdose and weird stuff.
The cola nut as well. But don't you remember I don't know if you were part of that conversation, but I remember I'm pretty sure it was, yeah, taking bath in salt, and it ran through Nigeria in a night. And
Yeah.
I remember like the next
People
morning,
waking up at 4 o'clock in the morning to have baths and
yeah,
salts.
like mothers were calling their kids saying like, you have to get up right now. I remember the cleaner being like, my mom called me at 4 a.m. and she said I had to wash the children and myself in salt, in a golden water salt bath, whatever it was, like right now. Just like the crazy level.
And then some people were like bathing in it. Some people were like, you've got to
Drinking it.
drink 3 buckets of it and
Yeah.
then dying. Yeah, I mean, more people died in that one over ingestion of things than died during Ebola at the end of the day.
Mhm.
And like those 20 people that died were like in a day, and
Yeah.
just from like,
But it was interesting because like during that time it was it was much more of like the local cures. They weren't doing like what they're doing now with COVID with the
buying
medications.
erythromycin like from the distributors and like the pharmaceuticals. I mean, there was some stuff early on with like a lot of lemon and ginger, and a lot of people were like doing that kind of stuff. But yeah, the hydroxychloroquine that people were buying off the shelves, and azithromycin, and all these diabetes medications, and yeah, it's been very pharmaceutical
Yeah.
in its response, where that was like very much like, come here, TB Joshua will cure you.
Exactly.
I remember that being the one scary thing, is like, besides how scary Ebola was in and of itself in Lagos, the idea that people were like getting in buses from Liberia to drive to Nigeria to get cured by TB Joshua in his church because of his miracle cure that he was selling. And the fact that like by whatever miracle that didn't bring a ton of Ebola with it is like still kind of blows my mind, like how lucky that was. And it is just by chance that it just happened to not be so heavy in those areas where people were traveling from.
Yeah. And I think that like maybe in a lot of ways it kind of does make sense now that we're talking about it, though, because of how disgusting Ebola is. I mean, it really feels like the devil, right? And so I can understand why the response to that would be much more of religious or traditional healing type thing.
And remember, early on, the death rate was still 90%.
Yeah.
And it's only kind of over a period of time that death rate kind of, I think, went down to like maybe 60, 70. But that's still, when you compare that to 1%.
Yeah.
That's a dramatic number when you think about scale. And if it was anywhere near as infectious as COVID, I mean, you'd be talking about 60% of Lagos just being gone.
Yeah.
And that's what worries me about the whole idea of pandemic preparedness, and just how like, I think Ebola showed all these gaps, but also showed that there was steps that could be taken to fill them.
Mm-hmm.
COVID showed that, one, we didn't take any of those steps on a large enough scale, and the gaps were even bigger than we thought, and the systems were way more fragile than we thought.
Mm-hmm.
And so like, even the confidence I had after Ebola being like, okay, there's stuff that can be done here, I didn't realize how quickly it could be wiped out, and the whole world would just go completely nuts with wanting to spread the disease and thinking it's the right to spread the disease as fast as possible. Yeah, it's very weird. Like, we are 100% screwed if there's a more deadly pandemic. Like, even after COVID, there's no preparation. There's no change in systems. The only thing we've done is figured out is like, no one will wear a goddamn mask. If you ask them to, they will refuse. Maybe if it's an Ebola-like thing, maybe that changes.
And that's the only thing I can think is like basically is how disgusting the disease is and what you're dying from. Again, if you're dying from coughing up blood like that, I think that's going to be.
But don't you think that's a bit crazy? Because we didn't know how deadly COVID was. But everyone was like, no, screw that. I want to see how deadly it is first before I take any precautions. Because if you take precautions and you're successful, they'll be like, well, what do we take all those precautions for? So we don't all die. They want to see people dying in the streets, and then they'll be like, okay, fine, give me the mask. Again, we're screwed.
Yes, correct. I'm not disagreeing with you.
I just think, yeah. Anyway, that's, I think, from the outcome of, because we had that during Ebola as well. Like, not so much in Nigeria, but as time went on, there was like, well, is Ebola real? Because that started creeping up in Lagos even.
Mm-hmm.
But things were more under control. But in Sierra Leone, that was like a common thing.
Yeah.
Like, when I got there, and they'd been dealing with Ebola for almost a year.
Mm-hmm.
And when we were in Sierra Leone, they were like, but is Ebola real? Or is this just a government thing?
Yeah. Well, we'll get to that response another day. So we get into Lagos, and what were and this is why I actually had tagged you in this to try to remember, because you were doing so much more of this work than I was doing. So what were the key things that we really were down there doing? I mean, we did the EOCs, obviously.
I mean, it was the whole handful of things. It was figuring out, one, what the physical infrastructure was going to look like, more around the coordination, less around well, we did some work on the treatment centers in terms of like supplying them with like power and things like that. So it was like basically making sure things could work, setting up the physical infrastructure, obviously the communication, the data tools, and then managing a bit of like the kind of incoming and outgoing finance around when things were provided and donated. And when I say finance, some of that was also in kind. So, the donations from like the fuel companies and the vehicles and those things. So like managing a bit of that incoming and outgoing stuff. Because remember, all the health workers were on strike as well.
Mm-hmm.
So, some of it was like figuring out, okay, well, this group is offered to pay them. I think there was one foundation. So we had to kind of coordinate them getting the money and then coordinate it getting to the contact tracers or whoever was doing the follow-up. So it was that whole setup, but it started primarily with the infrastructure, but then it kind of just got layered on because there was no one else to do all of these other little bits. I remember the coordination team would meet. You'd have all the Ministry of Health people, but then they'd be like, okay, well, who's going to pay who's going to fuel the cars that are going to take the contact tracers around? And then, that's when we started kind of emailing around with different groups. I remember like Airtel donated a bunch of like phones for the contact tracers. Awando donated the
fuel,
but like all the private companies wanted to participate, but like none of them wanted to work with government because they knew that it wasn't going to go anywhere. And so like once they knew we were there, they just started calling me all the time being like, we've got this. How can we get it to you?
Yeah. Which I guess is one thing that the private sector probably learned better out of that response was the creation then of COVID, which was, their ability to respond to the emergency. So
yeah, unfortunately, it wasn't an improvement.
It was not an improvement, no, because still bureaucracy happens. But yeah. So out of like all of those people, do you remember like who were like the real heroes during that time? Not the people who necessarily got the credit at the end.
Yeah, I mean, I think the impactful thing was the FETP fellows, like having 50 or more trained epidemiologists that could really kind of hit the field and know how to like track down and trace and report back. And I think that was really probably the thing that had the most impact was being able to have them get the data quickly because we had this backlog in the lab because the vice chancellor had to sign off on the results, but he was always traveling. So once we put an ODK form in place that he could just like click on it and say it's approved when he was wherever he was, then we could get the results the same day and we had the dashboard, but the FETP fellows could then do all the follow-up and things like that. There's a lot of administrative movements. I mean, I actually do think Faisal did a really good job bringing the partners in and like letting them do their work. Because even during some of the polio things, with the incident commander at Sano, like the partners were there, but there was a lot of like fighting back and forth. And this kind of like the government's in control kind of thing. We're in charge. But with Ebola, Faisal was much more like, okay, WHO, you're doing that. UNICEF, you're doing that. Great. There wasn't this like, I'm the boss, I'm in charge. You guys have to do what the government wants you to do kind of thing. It was very much like he let them kind of set the direction and let the experts kind of make the decisions around or proffer the decisions around what they wanted, what they thought should happen. Mm-hmm. Like CDC had John Ferdinand was there for most of the setup and beginning. And so having someone like that kind of senior around that everyone was willing to listen to, I think really helped. One, it helped generally, and it also kind of like helped back up Faisal because Faisal and John would always kind of go meet separately and then host the meeting, and then people would kind of get in line. Even like WHO was relatively like in line. Like they weren't trying to run their own system, which they did in all the other countries. With this group, they were really kind of they're like, this is our role, we're in here, this is our team, and they did it. And they managed their pillar and contributed back, and that was it. They didn't try and take over the whole thing.
I mean, obviously, that's why that command control structure is successful, which is why they asked us to do it in the other countries. And again, lesson not learned as to why we didn't do that for COVID as well. Who knows?
Yeah. I mean, there's technically an incident manager at NCDC, but then there's also a PTF. And it's just that we were mostly constrained to Lagos, except when they also opened up the Port Harcourt one. Mm-hmm. But yeah, kind of that idea, like setting up and having the states kind of like have this leadership. Yeah. And with COVID, it's just a mess. Like there was the infrastructure in place in Nigeria to do exactly what needed to be done. But instead of NCDC tapping in and saying, okay, we have these state EOCs, this is what we're going to do, this is what we've done, they kind of tried to do everything up front. And then there was the PTF, and then it was kind of confused between who's doing what. But then as the states kind of got up to speed, they're like, well, this is our job. Why are you telling us what to do? It's just...
Yeah. I mean, it was very different in how the whole thing was done, but it's frustrating looking back. The setup for Ebola, I think, could have worked really well and I guess it's more the setup for polio would have worked really well for COVID if there had just been maybe a more conscious decision about doing that. But the presidential task force was already set up. That was already kind of like a thing. And so it'd been hard to...
But also no one sat down and said like, well, what worked? Like, this is what we learned and this is what we worked. But what happened was They sat down and like, oh, once the cases hit here, one, very few people did like pre-prep work. Like the lab infrastructure building capacity like didn't start until cases started actually hitting. They're like, oh, we should have labs that can do this. And also then they're just like, oh, well, everyone else is locking down. Should we just do a lockdown? They didn't actually go through the process of like, what would that lockdown look like in Nigeria?
Anyways, I think we'll have to do more conversations about COVID in general. But yeah, it's really hard to talk about Ebola without comparing it.
So I was going to say the other thing I think that really also had a big impact there was all the private sector work.
On Ebola.
On Ebola, yeah. Yeah, if we didn't have fuel from Owando and Total and cars, and if we didn't have some of the private foundations step up and contribute to pay those salaries for the contact tracers and actually the medical staff themselves, like this would have not gone very far.
Yeah. So then I just wanted to highlight technically to just remind us about the payments of this. So again, we got called down to support, and I tried to go back through the emails to really fully understand. But basically, like BMGF told us that they would front the cost. Then MPACDA was supposed to pay us, and then we would reimburse the foundation. That was the original agreement. Yeah.
And there was $1 million. It was Dangote had set aside $1 million response fund that was going to go through the Ministry of Health. And then that number just kept decreasing every conversation. Well, no, it wasn't $1 million. It was this. And I was like, well, I've spoken with the Dangote group. I know it was them. But then the funny thing is by the time we got around to them, because I thought they were aware we were involved. By the time I got to them, they're like, oh, you guys are doing it. We would have just given the money to you instead of putting it in the government account. But it went into a government account. That money never, well, as far as we can concerned, that money never came out of that.
It never came to us, at least.
Yeah. Then we kind of settled on about $400,000. Or first it was 600, then it was 400. And that was it. That's when we actually ran out of cash. We're like, well, we can't spend it anymore. We had about $400,000-ish in the bank and we spent it all. And then they were like, oh, that million, which was then 6, which was then 4, is now 0 and there is no money coming. And that's when I remember like wanting to die.
Yeah, and I remember wanting to kill you. Yeah. So, but I have this memory of me calling Michael to tell him this.
I think so.
Yeah, because I remember specifically having a call with Faisal, and Faisal being like, they're sending it to your account. Because I remember I was driving from the house to the office at the time. Like, I remember very specifically this conversation. I just remember being like, Faisal, like, there is no money. Just being like really freaking out at this point. But I do think it was me that ended up calling Michael and saying, like, they have not paid us. Like, will Gates Foundation just cover the cost of it? And he said yes. I do think it was around that 400,000 mark for the EOC. But then who paid for all of the other support that we gave, like on the contact tracing stuff? Did we have another?
We all did that.
We just did it for free.
Well, we all did it within
the budgets that were
the $400,000 that we had.
Okay. Well, I'm sure that there was a lot of work that was paid for by, the polio funding and stuff like that. But yeah.
Yeah, the staff that were already on those things. Because it wasn't Michael. There was another call we had with Michael, and then I feel bad for forgetting her name, but she was in charge of because they have an emergency response team at Gates Foundation. Mm-hmm. Yeah. And there's the woman that was in charge of it.
Yes. And you're right. And she gave us money.
That's where the 400,000 came from.
Yeah.
And they basically just balanced it. We were like, this is how much we spent. And they just put it back in our account.
Yeah. Did we get any other money for Ebola from anyone else in Nigeria? I don't think so. I think that was just it.
I mean, again, nothing that came to us. Like, it was a lot of like someone allocated money and we made sure it got paid.
Yeah.
So there was a lot of like, there's some small managing of funds, but it was just like, this person's donating, we're putting it there. This person's doing it, we're putting it there. And it was a lot of things like fuel vouchers and food vouchers.
Yeah. Okay, so then it spreads to Port Harcourt. And I remember it spread because some people had run away from the Ebola treatment, right? I mean, were you still in country when that happened? Do you remember? You must have been, right? Yeah. Why did I go to Port Harcourt? Because I wanted to?
I think because I was preparing to go to Sierra Leone.
Maybe. Or was it because you were doing a lot of the contact tracing stuff in Lagos? But I feel like that would have already kind of happened.
I mean, we were doing lots of stuff, but I remember like we decided that we would go to Sierra Leone.
Yeah.
To do like an assessment visit, even just the initial, because we didn't even have that contract. We had like a consulting contract.
Yeah.
Like for a few $1,000s. So I agreed to go. Yeah, and I think I took like a break.
I remember I did it because you were completely burnt out and I still was okay because
I caught some like flu or something.
That, and I just think you had worked yourself like a crazy person for like a month. I remember you and I were at each other during that time quite a lot. Like our arguments were a bit intense, but I think it was just a lot of stress at that time.
Yeah, I remember like, because I got to that one room when I was sick and I slept in that room. I didn't leave it for 3 days. Like I just like, and then eventually I felt well and I was like, okay, well, it's just a flu. I'm not dying. And then went back to, I think, Kano for maybe a week. Yeah. And in that whole time you were setting up and then I was preparing to
Mm-hmm.
get out.
Oh, well, I mean, so if we're talking about payments, so that was an interesting thing because remember the state government paid us.
One, we were very specific, like we're not getting
Anything. We're not moving until we get the money. Yeah.
Upfront payment. We need this much money, then we'll go.
Yeah. But I thought it was really funny because I remember going to Port Harcourt. I remember being in the place and developing the budget with the special assistant to the governor who was going to be paying us. And I remember so specifically saying, like, if you want anything added to this, I said, now is the time because this is my actual cost of what I need to do this. And if you guys then come and ask me for anything after that, I don't have any money for you. So I said, if you need to add anything, tell me what it is so I can add it into the budget now before we submit to the government. And I remember the guy just being like, not like offended, but like, this kind of like, I don't even know what you're talking about. Like, this is an emergency. We would never ask for anything. And again, I think that this was still, I was so naive back then. And me just being like, this is so great. The state governor is willing to pay for this. They don't even want anything. They're just going to pay us and we'll do it. I mean, we weren't stupid enough to start work.
I don't think you were that naive. I think we were very specific. Like, we were just like, well, get in there and get out before they ask for something.
Yeah, I guess. Yeah. But I mean, I should have just put money in it from the get-go. Like, is really what I should have just done. But
no, I think we did it fine.
I think we did it fine too. But I remember I got on the plane to leave and I remember Femi at the time was with us, and I remember him calling as I'm on the plane and saying, you need to get off the plane. The governor wants to shake your hand. And I remember being like, no way in hell am I getting off this plane. I was like, I know exactly what you mean when you say that. And I said, I already told them no, I'm out of here. Like, because we had already spent all the money. We'd already done all the deliverables. So there was zero reason for me to do that. But I just remember thinking like, those motherfuckers, like I told them if they wanted something to put it in the budget, like they can't come back to me now. So. And
to be honest, like, what we know now, I mean, it's very possible that if the governor was there, like they would have like figured out and they would have like, but can you spend more money?
Yeah. Because I'm sure the budget wasn't very much. I'm sure the budget was like $100,000.
I remember being in the 200,000-ish range. But yeah, I mean, I'm sure on paper they spent $1 million.
Yeah. But again, great. You guys take care of that behind the scenes. I don't need to participate in any of that. Yeah. And also, like, you guys know how to do that way better than we do. So just do what you're going to do and then just leave me out of it. Which it did happen that way and they were able to sort it out. So that's good. But we didn't do anything else there, just the EOC, I think.
Yeah, and just ran it for a couple months, I think.
Yeah, it wasn't very much. So then I remember, so I had to look this up. Nigeria was declared Ebola free on October 20th, 2014. Do you remember where you were? You must have been in Sierra Leone.
I assume Sierra Leone, yeah.
Yeah. I don't remember celebrating. I don't remember taking a breath. I don't remember doing anything, being like, congratulations to us.
Yeah, no, not at all. I couldn't really remember. I know because it was September that I was in Sierra Leone. I might have even had already moved to like Liberia by then. There was a lot of like movement around that time.
Yeah, I know you were gone. I know I was for sure still in Nigeria. But even that, being in Nigeria, I don't remember any sort of celebration or anything.
No, it was just more about like, how do we like clean up and get back to work?
Yeah.
Because like we, all the Nigeria work, like we were net zero after all that. Like we'd spent all that time and then we had to kind of get back to polio work and like we just broke even on everything that we did. So it wasn't like we made any income. Well, we didn't make any net income.
Yeah.
I do remember there was a lot of talk about like, because everyone wanted to be like, oh, well, can you help us build a center so we can prepare for the next one? So there's a lot of running around like afterwards. I remember Atif was running around meeting with people that wanted to build whatever. And it was a lot of like state contracts where people they had all this money that they were able to allocate and they wanted to spend it, but they didn't actually want to build anything. It was just a way to embezzle money. And so none of those actually came through, I think, except for like the airport thing, the thing that we put at the Lagos airport.
But again, that was an NGO gave us that money. So.
But all the state contracts, never came.
So what is your opinion? Was Nigeria successful in stopping the outbreak or was it luck?
I mean, it's hard to not have a little bit of both. I think the system worked as well as it could. Obviously, it would have fallen apart if it didn't have private money because not a single Nigerian naira got spent from the government side of things, which is quite shocking. So it could have easily been terrible. Like if we didn't finance it, if we didn't put $400,000 up front to pay for all that stuff, what would have happened? There would have been no staff, no contact tracers. There would have been nothing. Like, so
no location. I mean, no EOC.
Even take the EOC out of it. Like the doctors were on strike. They were not willing to do contact tracing. The FETP fellows, I guess technically they were paid for by CDC. So they were like sent down there, but like they didn't have cars to get around. They didn't have fuel. I mean, they didn't have all of these things. I guess maybe they could have sorted it out, but like there was a lot of stuff that happened that if it didn't happen, it would have been really bad. And things moved so quickly that things were under control quite fast. And so there was a good thing. That doesn't mean that it wasn't luck. There was just like some behavioral luck things that happened in Lagos that really kind of freed up the space for that. The fact that so many people left as well to get out of Lagos, like, so there was like the congestion was gone. That obviously helped stop the spread because people went back home, and luckily they went back home before they could take it with them.
Yeah.
Again, luck that those first few cases got identified so quickly.
Yeah.
And isolated so quickly.
Yeah, and I think that's probably the major thing is like the way that it came into the country.
Mhm.
If it had come in, like you had said, on a bus, then we would have been, I think, totally screwed. But because it was a wealthy person that came in on a plane and then was brought to a private hospital, yeah, that was fortunate, I guess.
And then that private hospital, that nurse passed, like, making the decision to like not let this person leave when he tried to leave. All of that, those actions combined with some luck, combined with some like quick responses, I think is what ultimately led to that happening.
I never saw that movie. Did you?
I started watching it.
And it was really bad?
It wasn't great. I mean, it might be worth a watch just for fun.
Yeah, I think it'd be fun to watch. Yeah.
I do think that there were some key lessons that could have been learned and implemented. And I think then what happened is then, NCDC and some of the other states were like, okay, well, now we're going to learn from that and build all this infrastructure. But like, it's like infrastructure like in name only. There's no processes. And the reality is it's money. At the end of the day, if you don't allocate money to deal with an emergency response, it doesn't matter if you have a building. Doesn't matter if you have staff. Doesn't matter if you have a fancy contact tracing app.
Yeah.
Like if there's no money to get things moving, things break. And that's what I think we've seen during COVID is like, yeah, great. Edo has an EOC. Great. Now, what do they do with that EOC? They can't hire staff. They can't set up treatment centers. They can't pay people money to stay at home. Like during lockdowns, they can't do any of that. They just have a building that has the letters EOC on it. And that's different than having an actual emergency response and the ability to respond. And I think those things in Nigeria get convoluted together because again, emergency response is always like your kind of coordination pillars, your epidemiologists, your logistics, your whatever, but the biggest one's always finance. And if your finance isn't there, then there's no point.
Yeah. But I think like the kind of shocking thing is how little money it actually takes to get things moving.
Yeah, when you just do it.
I mean, the fact that, again, you were saying that like our $400,000 got things moving, that's a penny in the bucket of emergency response money, I mean, so it's just being able to utilize money effectively. And I think that that's also like, again, the point is that the process is to manage that money quickly. And they definitely, I don't think, have that.
Well, I mean, very few people do, right? And that's the challenge. Like,
which is why it's almost so frustrating that, again, in the last 10 years, so many all of the organizations like us have failed because now you're left with small local NGOs who cannot take that type of money because they have no experience managing it. Or you have these giant NGOs that have so many processes in place that you can't buy a $10 fuel card. Yeah. So there is a reason why organizations like ours should exist. And it's a shame that we don't have them.
Yeah, like, and it doesn't even have to be nonprofit, but just, in the US, you have all these contractors that when something happens, like FEMA signs a guarantee of payment and a bunch of food and water shows up because those contractors know that US government's good for the money. Once I get that email saying they're going to buy the food, I drop off the food. I don't even think about it. I do it the same day. I get that email, even if the money comes a month or 2 weeks or whatever later. But in Nigeria, none of those private companies, no private companies are going to be like, oh yeah, I'll take your guarantee of payment and then spend all this money. And, and you get these issues of where like the US agencies in charge of emergency response overseas aren't like FEMA. They can't just issue these quick emergency fund contracts. Like CDC, our emergency contract took
a year.
Yeah, to come through. And that was an emergency fast-tracked approval. The vaccine trial, I think, was a little bit more sped up from that because that came from a different pool of money. But like, yeah, it just shows you. And then Trump at the helm and the CDC, it just shows you how much that institution is broken. Like the CDC is a useless organization when it comes to like disease response. Like
now, I mean, yeah.
It's now and it was then as well. Like, because that was, I think, the other eye-opening thing is they were sitting there. We were spending money. CDC was in the room in Lagos being like, oh, well, I'll make some phone calls to see if we can get some approvals. But they had no money. They had the risk of like Nigeria having community spread of Ebola, and they still had no money. And they had no window at which they knew they were even going to have money or get approvals. Like from that point, it took a year.
Yeah.
to get any actual government money out of that process. And then that was during Ebola when people were active and trying. Then during COVID, they were completely dismantled and even less effective. And I think going forward, well, it's the same thing that happened now. Like, we had the whole discussion about WHO being the coordination mechanism after Ebola because they were so useless. And they got even more money, said, we're going to do a reform, we're going to reorganize. And they did that. And then COVID happens. And then what? There's some guy on TV every night giving an update about like how the numbers are in different countries. You're like, what in the hell does that have to do anything? Why are you holding a press conference? Go away. It's such a useless, expensive ordeal that doesn't actually add any value because all the countries were like, well, how can WHO help us? And they're like, oh, they can't. Do your own thing. Okay, we'll do our own thing. But then WHO kept having daily press conferences just like to update people on what the numbers were. And it's like, people can go to the website and look at the numbers. We don't need you giving a conference, reading out that we should wear masks and read the numbers. It's weird that we're still here.
Yeah.
And we're still pretending like these agencies can respond.
Or the right people to respond.
Yeah, we're still pretending like they can respond to an outbreak. Even though we proved that they couldn't during Ebola, now we've proven again that they can't during COVID.
Yeah. Well, so I mean, going back to though, like, was Nigeria successful? Again, I think probably the biggest outcome from Nigeria was the fact that like the model of the EOC and the command control worked because until Nigeria, they weren't even doing that in the other countries.
They weren't even doing it when we arrived there.
That's what I mean. Yeah. So it wasn't until like, Nigeria was able to say this worked and that, the other countries or the groups, whatever, in those countries said, okay, we're going to do the same thing. But
that's because they had 2 years of polio experience sitting down in the same rooms, agreeing on work plans. And even though it was a struggle, they just had that experience. So going and sitting in the same room and WHO saying, oh, we're okay with you being in control. None of the other countries did that happen.
Yeah.
They were still fighting over who's in charge when I got there in September.
But so I think, like, if anything, I think that was a fairly successful piece of Nigeria if Ebola had never come to Nigeria, I think that system may never have even reached the other countries, as the right model to run the response. And then who knows where, how that they would have managed that response, again, in that siloed kind of manner. So if anything, I think that's kind of interesting. But then I guess the question here really is because we've had the Ebola cases come back in Guinea, and I have not heard anything recently, by the way, which is concerning about that. But say it comes to Nigeria again, do you think we could do it again, at the same type of level of, 20 or so cases?
I don't think so.
I don't think so either. Why don't you think so?
I think because the government would try and do it themselves. Like they're less likely to kind of let another group or let that kind of system work. For example, it landed in Lagos. Lagos State didn't run the coordination. They let this group do it from national. They let them have it. They would not let them do that now.
Yeah.
Because one, I don't even think it's like an ego control thing. I think it's more of just like they want the money. Because Lagos State during the Ebola response had their own EOC that they were feeding money into, but they weren't doing anything. And it was just a way to, like, I think, move money around.
Yeah, which is fine as long as the response can still happen without, that fight.
But I think now you'd still have a fight over, like, even with NCDC there, you'd still have a fight over, is NCDC in charge? Is the Lagos State in charge? Is the president in charge? And then you'd have this issue of like, okay, well, who's paying? Since you guys have your emergency system, do you contract? Like, they'd still want us to then provide support, but they don't want to pay for it. And if they do pay for it, it's these long government contracts you can't trust. Yeah, unfortunately, I think if it happened, it would break down just like it did over COVID.
Yeah, I completely agree on that side and would add, I also think that like the general public's response and mistrust in government and in healthcare, I just feel like has been amplified so much since then as well too, that I don't think that people will do what they're told to do. I don't think that they will believe if it comes back. I think that they'll say that it's government trying to control them. I just think that, like, and rightfully so.
Or they'll say, don't worry about it, go buy the hydroxychloroquine.
Yeah.
Like, there was a lot of misinformation being spread during Ebola.
Yeah.
It's gone up 10,000 times.
With COVID.
Yeah. So whatever the next outbreak is, I think we're going to suffer the same fate because I don't think we've learned anything. And I think it also shows how important, even with things happening in Nigeria, how important like global leadership is. The fact that we had Trump during the majority of it kind of also led a lot of people in Nigeria to be like, well, the U.S. isn't taking it seriously. They don't think it's a problem.
Mhm.
Why do we care? And there's a lot of that kind of watching what other people are doing. And with the US not really caring, that led to, okay, well, why should we listen to NCDC tell us it's serious when the US doesn't think it is?
Yeah, it's a really good point. But the other thing too is like, again, it's just so crazy to think about like where we were technology wise and communication wise in 2014 versus where we were in 2020.
Yeah.
And, the amount of people using WhatsApp and with access to information and all of that has just like really blown up, which is fabulous. But yeah, it just means that the misinformation campaigns are huge.
Yeah, and this access to the internet somehow makes everyone feel like they can become a public health expert, including like all the pastors. And
well, even just the things though about like sharing around the misinformation is way easier for people to be taking videos of things and then saying, I mean, they could definitely be true, or twisting that story a little bit, and then that goes viral.
Yeah. I'm really interested to hear what different groups are doing when it comes to this discussion, because no one's talking about, at least I haven't heard a lot of discussions around like, what is WHO? Like, what are they doing? Like, what is their role when the next pandemic hits? Because their role this time was useless. Even COVAX was set up with a separate administration, like, yeah, with a rep from WHO, but not like even inside WHO. And to me, that's kind of mind boggling. Why did we have to create another administrative unit if WHO exists? If WHO does what theoretically on paper they should be doing, why does COVAX exist? Why isn't it just a unit within WHO? But it's because they don't have to. Anyway, there's a lot of things like that where you're just like, okay, what do they do and why are they there? And given that we know they're not a useful response agency, why are we still giving them money?
Yeah, and why are we preparing for the next pandemic with them as
the lead of the money? Because people have sent all the emergency response money to them, and it still takes them months and months and months to get that money out. And it like just seems,
and again, we're not even allowed to get any of it, which is like the crazy thing.
You can't get it from WHO. It makes it really hard. Yeah, and so I think that like they've actually responded to Ebola by making things worse.
More bureaucratic.
Like, I mean, they said the same thing with Ebola. Like, oh, main mistake they made is not declaring it soon enough. And then what did they do with COVID? They just kept being like, well, it's not a pandemic yet. And everyone was like, it's a pandemic. Just call it a pandemic.
Yeah.
And their money for their pandemic response doesn't get released, because then when they call it a pandemic, then someone's got to do 1 month, 2 months of paperwork to get money even distributed to start or people distributed. And so they just delayed everything by an extra month for like something that spreads as fast as COVID. And again, if anything's ever deadlier than that 1%, like we're really screwed.
Yeah. So I wanted to talk about this because I was going through these emails and like I was just shocked by some of the emails. But so who are some of the key staff that were working with us at that time? Do you remember like who went down with you to Lagos?
Eventually, I know Atif was there.
Yeah. Dee Dee
was there.
Yeah. Was that when Dee Dee started with us?
I think it was around the beginning, yeah.
Yeah.
I know Justin was there for part of the time.
Yeah. Do you remember anyone else? I mean, I remember Femi.
Yeah, Femi.
Yeah.
There was the woman that was like, actually, she was in Sokoto for a while. She came down to Lagos. She was our coordinator in Sokoto. Ori.
Oh, okay. She went down. She still was with us.
Yeah.
She's been on my team.
Yeah, she was there. Mustafa from the Dykes were there.
Yeah. But that was basically it?
I think from our side, yeah, we didn't have many.
Yeah, we didn't have that many. Okay.
I feel like other software developers came.
I think more software developers.
Like Musa and...
Yeah, I think there was a small team of software developers down there with you guys. I don't know where they must have been working out of.
I don't think they're there for long. I think they kind of came, worked on some stuff, and then did most stuff remotely. But there was like someone doing like IT stuff for me. I know there was a lot of stuff with that stupid system they were using.
Which, I mean, makes sense because there was a fair amount of
Yemi
IT.
was definitely there.
Yemi, yeah. That makes sense. Because the IT for the EOCs as well, so that made sense. Yeah. Because I was going back and reading through, and we'll have a whole other episode where we just kind of talk about like our growth as leaders and, kind of like management styles and stuff like that. Now we're at the end of this kind of conversation. I guess my question to you were like, what were your top craziest moments from the Ebola response that you remember?
I mean, the biggest one that stands out was just when all the ambulance drivers hadn't been paid, because we thought they were being paid. And they all just showed up at the OC demanding to be paid. And so...
And what happened?
Well, I was just convinced I was like, well, got Ebola now. Great.
Well, explain the scene. What happened? So how many people came and stormed the EOC?
Well, I mean, it wasn't a storm. Like they just walked in. They were like, we're not leaving until you pay us. Like, we're not.
What, like 20 people, 100 people?
It was probably like a couple dozen. Yeah. But it was like, it wasn't a big space. I don't know what you're looking at me for. Like, I don't pay salaries. Like, I don't have anything But I remember having to like realizing, okay, the government had promised to pay their salaries. Obviously they didn't. So then I had to call the woman that was at that foundation that they set up that was coordinating things. And then she made a few calls and it was like, then the money came from some rich bank person.
And what else?
Yeah, I mean, I think like that was the kind of scariest thing because I just remember thinking like so terrified of Ebola at that point. And I think that was close towards the end when I was like sick. I kept thinking back to that moment. I was like, here's people that have been like taking dead bodies around Lagos and driving infected people back and forth. And now they're just sitting here and I'm like, great, we all have Ebola. And then I was like sick like 3 days later or a week later, I guess. That sounds like incubation time. I mean, what was crazy was how disgusting that central public health lab was. Mm-hmm. It was biohazard zone. I mean, it was so gross, like indescribably disgusting. And we had to turn it into a functioning center in like a very short period of time.
Explain this to me. Why was it disgusting?
They had some labs running down at the bottom, but they didn't do like incineration. When they were like finished with the blood samples, they would just dump it down the sink. And then the sink just ran out into the courtyard. So there's just like this kind of bubbling brook of like blood and waste from the lab. And then that was on one side of the courtyard, which we had to clean up and then obviously close all that up and spray a ton of like disinfectant and chlorine and not go anywhere near it. And then, yeah, the rooms upstairs, which were kind of functioning labs, but they had obviously been not used for a long time, just had old specimens that they hadn't thrown away that were just like rotting in the corner. And like, you didn't know if it was blood or body parts or what. I mean, it was really bad. And all that had to be taken out, like people like in hazmat suits taking it out and just like burning it. And then, yeah, then having to like clean that up. Yeah, it was a special level of gross.
Mm-hmm. And then what about that story about the time that the guy with Ebola came into the EOC? Were you there for that?
I don't think I was, actually.
But do you remember the story?
I vaguely remember it. I think people made a big deal about it, but like,
yeah.
Thought he had Ebola, or did he actually have Ebola?
I think maybe you're right. I think maybe he thought he had Ebola and he came.
Oh yeah, because people thought that was like the treatment center. No, actually that happened a lot. You're right. Sorry, people kept coming thinking that's where they get like when they were really sick. So yeah, these sick people kept showing up wanting to get like treatment for Ebola, and yeah, that caused a lot of.
Rightfully so. It would freak me out. Do you have any like really standout best moments during the response?
Yeah, I think the best moments for me was like I really kind of got to know a bit more about the actual intricacies of an emergency response. Like we knew roughly the polio system, but the polio system was kind of like a modified emergency response, right? Yeah, there weren't the kind of pillars and management systems that needed for a more like rapid response. And so I, got to learn a lot of that from John Vertifay. And I think it was Lisa who took over for him afterwards. So I thought that was good. And then it was actually just like, I was working with all the private sector groups. Like I found that, when I got to kind of like, meet with Total and, they approved the vehicles. And then I got to meet with Owando and they approved the fuel. And, those were like the good moments. Cause like one, I wasn't dealing with whatever the government was doing and kind of got to like make things move and keep things going without spending any more money. Because we didn't have money to spend. So it was just asking people for money or things.
Yeah. I think another kind of really interesting thing that came out of that response was it was the first time that you and I were working like very separately on different things. Mm-hmm. And I think that it was just like a really great experience to be able to know that like we both can do it on our own. I think that obviously we're better together when we can like strategize. But at the end of the day, both of us can run these things on our own, and that basically kind of doubled our capacity to do things. And if we hadn't been that successful, there's no way we could have done what we were doing in the other countries. If we both had to be kind of helping each other along the way. And I think like again looking back, it's hilarious to think like I was 24 at the time that this happened. And for me personally, I think that was just a really good growth experience of like for my confidence as well of like you were gone and I couldn't ask your opinion about these things because you were doing your own thing. So I was running the entire company basically by myself while you were running the Ebola response in Lagos. And I thought that was for me a really good experience. Stressful, but good. Which again I think is why you and I were kind of at each other's throats for some of that. But
and I mean it was stressful, but like I mean the thing that we learned even later on was around, like you said, the leadership and the staff. Like we had these senior staff that we let mess with us and mess with other staff and bully us and manipulate us and cause all this extra stress that didn't need to be there. And I think didn't really learn it as an outcome of Lagos, but definitely learned it as an outcome of that expansion in general, right? And that like people are really toxic and figuring that out early on. And as soon as you see those toxic traits, just immediately ending it not letting it be like, oh, okay, well, maybe they were in a bad mood, but just being like, that sounds really toxic and manipulated. Goodbye. And that's obviously my attitude now of like, just don't, like, it's so destructive, so amazingly destructive. Like,
yeah. So yeah, the fact that we were able to do all of that, and it kind of was a lot by ourselves, to be honest, like we didn't really have that much support. Yeah, it was fairly impressive. And again, at the age that we were at, you would only just turn 30 too, or 29, whatever. Yeah. So you could go back and something differently. Is there anything that stands out that you have like a regret about, like, oh, I would definitely have done this differently if I could have?
Not necessarily for Lagos. I mean, I think the only things that could have been better is if it was financially better for the organization. Like if we could have figured out how to play a more essential role in, like, for example, like I worked with that foundation. They set up all those donations. Like that foundation still exists. They made so much money raising money during Ebola. Like they still exist. And it was only just because we didn't have the capacity to that we didn't do that, right? I mean, it was like they were a good, easy outlet and they were really, really helpful. But like, if we would have had the resources and capacity, like we could have played a more central role in like coordinating those as well. And that probably would have led to more income during the thing. So it wouldn't have been a wash, but also would have kind of built up as the kind of leader in that space. Cause I think we left that space and not, except for the central people, no one knew what we did. Like that foundation that's left behind, like they're known for like raising the money to fight Ebola, right? I mean, and some of the other groups that popped up around that time. Like I think we didn't invest enough in the contact tracing software and really making that system work. Part of that was like we didn't necessarily have the right people, but there were some easier things that we could have done. Like we built basically what is now SORMAS, but obviously someone else took credit for it and then kind of made their own version of it, and now that's a big thing. And so I think there are like a couple big missed opportunities that were made up later, because I think running the vaccine trial later on was way more exciting for me than a contact tracing app that's used in 4 countries. Like,
yeah, no, I would agree with that. I think that like maybe it would have been nice, if certain things had happened differently, but I don't think any of that was our choice during that time. Yeah. I think the things that, were our choice was probably how we could have leveraged on what we were doing. I mean, I think like, and there was a little bit of, publicity that we did get. Remember I went to that Paris Nextplo thing and got that award, which was really cool. And I think we probably could have tried to make a little bit more of a name for ourselves afterwards.
Yeah, but in the groups that had that experience and knowledge in place kind of made a name for themselves, right? Like even like DHIS2 used it to their advantage. Comcare basically said, well, we did all the contact tracing in Sierra Leone, and we're like, no, you didn't. Like we did.
And I mean, it's hard, because like there weren't that many organizations that went from, I mean, we're the only one really that went from Nigeria and then went to all of the other countries. If we had only been in Nigeria, then sure, we would have had the time to have done.
Or even just only in Sierra Leone or only in Liberia, right? Yeah.
But I mean, we were stretched so thin. There was really 0% opportunity for us to do anything.
But I mean, I'm just saying, like having a team that could have like gone back and been like, okay, great. This is our kind of debrief. These are all the systems that weren't there. Like, let's spend time just figuring out like what a series of tools would look like. But again, we had that, our software leads were just like, they were more about like building really complicated, expensive things than actually like a useful set of tools. And I think that's where we kind of just ran in. Most of that software we just threw away, right?
Yeah. And I think that's probably what will be the main, if I could do it differently on the entire Ebola response, that's what it would be. Or actually even just as an organization, I think the solutions piece is really, but it's hard to say because again, hindsight is 2020. And like, again, the e-health, m-health world has changed so much in 10 years. It's really outrageous how quickly everything has changed. So yeah. All right. Well, we are at time, overtime actually. So I guess this was more of the Nigeria Ebola response, but also a slight comparison of the Ebola response in Nigeria to COVID as well. All right. Thank you. Thank you so much for listening to this episode of the EHA Founders Podcast. Please like and subscribe on your podcast app or on our YouTube channel so that you can be updated as we continue to post new videos about our journey and impact investing in Africa. Thanks.